Thanks, Jim. Thanks very much. James.
Greetings. So I should say that when it comes to policy and programs, I'm not allowed to say too much as a government employee, and particularly as a government employee who's an immigrant. I feel particularly sensitive to this factor. So I'm going to avoid. If I say anything that sounds like a policy or program-related issue, then it's just my opinion, and definitely not for me speaking for anybody else. So I just want to do that caveat. I mean, I think that, it's very exciting when you come to a meeting like this. You can see, Dustin had that slide where it was talking about community-based approaches and, more sort of individual-based approaches and where we're going to get the biggest bang for the buck. And we've certainly seen quite a few situations here. You were just talking about it. You were presenting data yesterday with respect to suicide. These stunning effects of community-based approaches. And I certainly remember something in the UK when I was there on a school-based approach for anti-bullying, leading to these massive reductions in bullying rates across schools, with the exceptions that you found this core group that did not change, that weren't affected. Now, violence went down because indeed the hangers-on went down. Violence also probably went down in those individuals because they couldn't organize other individuals to do activity, but the fact is that they still remain. And so obviously, as my part on this panel, I'm going to push focusing on the individual as well. I thought and getting back to the issues of research, I think it is, the issues about screening with respect to risk. We had some discussion afterwards. For me, I think if we can identify individuals who are at 50% risk of extreme levels of aggression, I think that's good. I mean, I've got to say, if we can do that, it's obviously the cost to the individual, indeed, of getting it wrong and being placed, continuing detention is very bad. But the fact is, we've got something that is relatively useful. And part of the thing I think we're really facing with is it's really a justice issue, rather than a mental health issue. When it gets onto that, we had some discussion about really, the role of mental health in this sort of decision making. It's a society decision as to what we're going to do then. But where it really becomes interesting is by being able to identify these individuals, which we can. We've got individuals that we can identify who are going to benefit, who we really need to target for treatment. These are the individuals, like the bullies that don't change in the school-based approach. These are the individuals that we really have to focus on to change their underlying problems. And again, I hope that I showed you some data as regards to the neurobiology that you found of interest. We do indeed have these techniques for identifying specific types of impairments that are linking to specific types of increased risk. The big question now is, are the interventions that we currently have tapping in? And we can be relatively confident. When you talked about CBT and the PTSD, that increased emotional response leading to reactive aggression, we can be relatively sure that indeed those types of interventions will work with those types of individuals. We will see a suppression at the biological level, and that will be coupled by a reduction in the aggression. It's not been brilliantly formally demonstrated. We certainly don't have the neurobiological backup, but I think when and if, and I'm pretty sure we will have in the next few years, that biological backup, it becomes a much more appealing package for the people who are delivering those services to be able to present to individuals who sometimes worry about the efficacy of programs. If you can show, look, we can really demonstrate that these individuals change their behavior for the better, and we also see a change in these underlying problems that these individuals were facing, it becomes, a difficult thing, or a more difficult thing to argue, and you get into the resource question, then, people should be paying, it gives you extra ammunition in these resource discussions. Then, of course, we've still got those individuals that who have these problems in empathic responsiveness, where current interventions do seem to be less effective. So developing interventions targeted for those individuals that really get at their underlying problems has to be a major priority. I think there are things that are exciting there. There are possibilities. It's going to be a question of whether if we can really shift the pathophysiology. We know we can with other disorders. We see it with PTSD. We see it with depression. You really can shift pathophysiology. You can make people, you can change the way the brain works if the intervention works successfully to make the person function in a more typical fashion, and you see that behaviorally. I see no reason why we can't do that with this population as well. And hopefully that's got me within. I didn't see any flashing lights and all the rest of it. And since I couldn't discuss about the other two, I felt a bit embarrassed about going on for 5 minutes. So there we go.